I hope you have already got a breakfast. So on the behalf, I would like to show my respectation to His Excellency Dr. Ned Borom, the Vice President of the International University. And I would like to say good morning to Mr. Kanchantun, the Dean of Department of English, Professor, judges, staff team management, and also the presenter are presenting here. As you already know, my name is Sokratana, a sophomore of the medical doctor and also the junior of Bachelor of English at International University. So today there is my great honor to make a presentation about the pathogenesis of malaria. So I think that all of you are presenting here have already heard and already known about malaria. Am I right? Can you say it loudly? Am I right? Yes. So to make sure that you got a specific information about the malaria, I would like to spoil it back. The malaria is a kind of disease which caused by infection of female Anopheles mosquito, which contain the infective form of the parasite and spread it out into the human body. So for example, I'm standing here inside the darkest room and also have only a lamp that allows me to read something. I'm standing here and I feel itching. So I scarred it and I continue my reading. But after a few minutes ago, I noticed that I feel itching again. So this is a bad girl. I have noticed that the mosquito have already bite me. I don't even notice about it does infection or not. So after 10 to 14 days, the symptom, also the sign of the malaria have been released. So, hello mom, can you take me to hospital? I feel sick. So after the diagnosis, the doctor have found the presence of the parasite inside my blood. And they admit that, oh, you got a malaria. So how? How can I got a malaria? How the mechanism of the parasite inside my body? So before go straight to the pathogenesis of the malaria, we need to know about the life cycle first. So in this part, you need to do the imagination about the mechanism inside our body. So this is the sporozoite which contained inside the salivary gland of the infected mosquito. So it travels through to the liver, through the human circulation, and enter to the hepatocyte to body format. The hepatocyte become rupture and release about the many million of the merozoite. So the new merozoite goes through to our human circulation again and infected the red blood cell. So in this case, the merozoite can be high within our red blood cell, which is our cell, and the immune system cannot be attacked. So merozoite be the body form having a sexuality feeding themselves on the red blood cell, and the red blood cell become rupture and release about the many million of merozoite. So those new merozoite will enter again to the human circulation and find another new red blood cell from the body on, and it become a ring cycle. So during this ring cycle, some parasites work as the sexuality, which release some symptoms or clinical features such as the fever, chill, and also the sweating. During the ring cycle, some parasites have the different shape that we can divide into the two main forms of the male and female gametocyte. So when the mosquito which is uninfected come to bite the human which carry the infective form of the parasite, and the male and female gametocyte will combine into together and form it as the zygote. Zygote will develop to the oocyte. Oocyte will grow as the oocyte. The oocyte become rupture and release the many sporozoites through to the salivary gland of the mosquito. So those infection mosquito will find the new human and bite for feeding. So they release the sporozoite through to the human body again, and it's cycle of malaria. So after this, we're gonna know about the pathogenesis of malaria. We already know that as the spleen of the human organ is standing for the killing the damage of the red blood cell. So the splenic macrophages will contain the best role to sensing and also the phagocytizing the infected red blood cells. So it have already killed about the many million of the red blood cells, and it can lead to be the anemia. During this stage, it can also produce the pro-inflammatory cytokine, which is such as the TNF alpha and IL-1 beta. The TNF alpha stands for the tumor neosis factor alpha, and the IL-1 beta stands for the interleukin 1 beta. So those two cytokines can be released when the macrophages and also the macrocyte are exposed to the parasite, and when the splenic macrophages are eating the infected red blood cell. So those cytokines can be released some of the symptoms or signs of fever, such as the paraxia, the chilling, also the headache, or excessive perspiration that normally as a sweating. Macrophages and also the macrocyte release the TNF alpha, IL-1 beta, and also the IFN gamma, which stands for the interferon gamma, to affect the small capillaries through to the brain, also the lung, kidney, and also the placenta. In the brain, the infected red blood cell enter to the surface of the protein, and the TFN alpha and also the IL-1 beta that release from the macrophages try to affect and increase the expression of the adhesion of molecule on the endothelial cell. So the adhesion of molecule on the endothelial cells, such as the CD36 and also the ICAM1. So for example, inside the brain there are CD36 and ICAM1, which stand on the endothelial cell. When the infected blood vessel cannot bind into the adhesion of endothelial cell, so it will clear up by the splenic macrophages. But if it can bind on the endothelial cell, it will be triggered and conjunction by the activating the thrombin, and it will cause the clotting, that it can be improved or release the tissue inflammation. So this can lead to got an obstruction of the blood vessel and also the local inflammation which caused inside the brain, that it normally as a cerebral malaria, or inside the lung it normally as the respiratory distress syndrome, or the placenta as a pregnancy, it normally as the placental malaria. But the different thing is the kidney. Kidney is normal caused by the anemia, which is the lower level of the red blood cell. So this can lead to be hypoxia and also the hyperventilation to increase inside the acidosis. So in conclusion, and to sum up my presentation, I would like to say that malaria is a kind of disease which is dangerous and damage our many of organs. So if you find any sign or symptom of the malaria, please go immediately to the hospital to get a diagnosis and also the well treatment as soon as possible. So thank you for paying attention and also enjoy my presentation. Wish you good luck.